the stroke that should never have happened. A few years ago, a man in his early 60s walked into a hospital emergency department speaking normally, but something felt slightly off. He wasn't screaming in pain, he wasn't collapsing. In fact, he kept insisting he was probably just tired. But within a short time, his speech became slower. One side of his body weakened, and doctors realized something terrifying was happening. He was having a stroke. And what shocked his family most was this. He had no idea a silent heart condition had been developing inside his body for years. No dramatic warning, no movie-style chest pain, no obvious emergency signs. Just a hidden rhythm problem quietly increasing the chance of a blood clot reaching the brain. And sadly, this happens to more people than most realize. Millions of adults are currently living with an abnormal heart rhythm without knowing it. Some feel occasional fluttering in the chest. Some feel tired all the time. Some feel dizzy once in a while and ignore it. And some people feel absolutely nothing until the stroke happens. Tonight, we're going to talk about the silent heart condition that can trigger a stroke without warning. How it starts, why it becomes more dangerous with age, the symptoms people dismiss as normal aging, the daily habits that quietly increase risk, and most importantly, what doctors try to catch before someone's life changes forever. My name is Dr. Richard Prime, and on this channel, we talk honestly about real health problems using medically grounded information in simple language. No fake miracle cures, no internet myths, no fear tactics. Just real education designed to help people understand their bodies before small problems become serious emergencies. And if you value truthful health content that could genuinely help protect you or someone you love, subscribe to the channel and join our growing community. Because sometimes one piece of information can change the course of a person's life. Now let's begin. What this silent heart condition actually is. The condition is called atrial fibrillation, often shortened to AFib. And despite how serious it sounds, many people live with it for years without realizing it. To understand AFib, you first need to understand how the heart normally works. Your heart runs on electrical signals. Tiny impulses travel through the heart muscle in a carefully coordinated pattern that tells the heart when to contract and pump blood. Under healthy conditions, the rhythm stays organized and steady. Blood flows smoothly through the body. Oxygen reaches the brain efficiently. Everything works together in balance. But atrial fibrillation changes that rhythm. Instead of beating in a coordinated way, the upper chambers of the heart begin firing chaotic electrical signals. The heartbeat may suddenly become irregular, fast, shaky, or inconsistent. Sometimes the rhythm speeds up dramatically. Other times it becomes erratic in ways people can physically feel. And sometimes the changes happen so subtly that patients barely notice them. Now here's where the real danger begins. When the heart no longer pumps efficiently, blood can start pooling inside parts of the heart instead of flowing smoothly. And pooled blood can form clots. If one of those clots breaks loose and travels into the brain, it can block blood flow and trigger a stroke within minutes. That is why atrial fibrillation is treated so seriously in medicine. Not because every irregular heartbeat is automatically fatal, but because untreated AFib can quietly create the perfect conditions for a devastating stroke. And what makes the condition especially dangerous is how silent it can be. Some patients experience dramatic symptoms. Others experience almost none at all. In fact, some people only discover they have AFib after suffering a stroke. That's the frightening reality many people never hear about. Why so many people miss the warning signs? One reason AFib stays hidden is because the symptoms often feel ordinary. People explain them away. They normalize them. They blame aging, stress, exhaustion, anxiety, dehydration, or poor sleep. And honestly, this happens constantly. I've personally seen patients say things like, "I thought I was just getting older. I assumed stress was causing it. I didn't think tiredness could come from my heart." And because symptoms may come and go, people become even less concerned. A person may feel strange for one night, then feel normal again for several days. That temporary improvement creates a false sense of safety, but the risk may still remain quietly in the background. One of the most common symptoms is heart palpitations. Some people describe fluttering, others describe pounding. Some feel like their heartbeat skips. Others say their chest suddenly feels shaky or unstable. And interestingly, many people notice these sensations more at night. When the body becomes quiet and still, abnormal rhythms become easier to feel. But not everyone experiences chest sensations. Some people mainly notice fatigue. And this is not ordinary tiredness after a busy day. This is a strange exhaustion that slowly becomes part of daily life. People wake up tired, walk short distances and feel drained, lose energy for activities they used to enjoy. And because the change happens gradually, they adapt to it instead of investigating it. Shortness of breath can also appear early. Walking upstairs suddenly feels harder. Simple movement becomes tiring. Some people feel dizzy or lightheaded without obvious explanation. Others notice brain fog or trouble concentrating. But because these symptoms overlap with so many other conditions, AFib often remains hidden for long periods. That's why awareness matters. Because sometimes the body whispers long before it screams. Who is most at risk? Atrial fibrillation becomes more common with age. Risk rises significantly after 50 and continues increasing over time. That does not mean younger people are immune. They are not. But aging changes the heart in ways many people don't realize. Years of stress, inflammation, blood pressure changes, and wear on the cardiovascular system affect how the heart functions electrically. And certain health conditions raise the risk even more. High blood pressure is one of the biggest contributors. When blood pressure stays elevated for years, it forces the heart to work harder than normal. That strain can eventually affect the heart's structure and rhythm. Diabetes also increases risk because it damages blood vessels and affects circulation throughout the body. Sleep apnea is another major factor many people underestimate. Some people think loud snoring is harmless, but untreated sleep apnea places repeated stress on the heart every night. Obesity, smoking, excessive alcohol use, chronic stress, thyroid disorders, and sedentary lifestyles may also contribute. And interestingly, some patients develop atrial fibrillation after major infections or surgery because physical stress can disrupt the heart's electrical stability. The body is deeply interconnected. That's why doctors look at the entire health picture, not just one symptom in isolation. The most dangerous part isn't the heart. And in just a moment, I'm going to explain something many patients find shocking. Sometimes the heart itself isn't what causes the greatest damage. Sometimes the real disaster happens silently inside the brain, long before families realize what's happening. And the first symptoms can look so ordinary that people mistake them for stress, aging, or simple exhaustion. How strokes actually happen. To understand why AFib becomes so dangerous, you need to understand how strokes develop. Inside the heart are areas where blood can pool when the rhythm becomes irregular. When blood stops moving efficiently, clot formation becomes more likely. Think about water sitting still. When flow slows down, stagnation begins. A similar concept can happen inside the body. Now imagine a clot breaking loose. That clot may travel upward through blood vessels toward the brain. Once blood flow becomes blocked inside the brain, oxygen delivery stops in that area. And brain cells are extremely sensitive to oxygen deprivation. That is why strokes are emergencies. The longer brain tissue goes without oxygen, the greater the risk of permanent damage. And here's something important many people misunderstand. Not every stroke begins dramatically. Some begin quietly. Speech may suddenly become slightly slurred. One arm may feel heavy. Balance may feel strange. Vision may blur unexpectedly. Confusion may appear out of nowhere. Family members often notice subtle changes before the patient does. That's why sudden neurological symptoms should never be ignored. Because with stroke treatment, time matters enormously. The patients that stay in your memory. As doctors, certain patients remain in your memory for years. Not because they were celebrities, not because they were unusual, but because their stories remind you how fragile health can become when warning signs are ignored. I remember patients who still looked physically active and independent, yet their heart rhythm had quietly become dangerous. Some had ignored symptoms for months. Others genuinely felt almost nothing. One patient told me, "If I had known my tiredness was connected to my heart, I would have gotten checked much sooner." That sentence stayed with me, because many people wait for dramatic symptoms before seeking medical help. But the body doesn't always work that way. Sometimes dangerous conditions develop slowly and silently, and unfortunately, by the time major symptoms appear, damage may already be happening. That's one reason regular medical checkups become increasingly important with age. Simple testing can sometimes identify problems long before emergencies occur. How doctors diagnose atrial fibrillation. The good news is that AFib can often be detected with relatively simple testing. Doctors usually begin by asking detailed questions about symptoms. Then they check pulse rhythm and blood pressure. An ECG, also called an EKG, records the electrical activity of the heart and can often reveal abnormal rhythms quickly. Sometimes symptoms come and go, so doctors may use portable heart monitors worn for several days or weeks. These monitors track rhythm changes during daily life. Blood tests may also help identify contributing conditions, such as thyroid disorders or electrolyte imbalances. In some cases, imaging tests help evaluate the heart's structure and blood flow. And importantly, diagnosis should never come from guessing online. Many other conditions can mimic similar symptoms: anxiety, medication side effects, dehydration, other rhythm disorders, heart disease. That's why professional medical evaluation matters. Because the correct diagnosis determines the correct treatment approach. The daily habit many people don't realize is hurting their heart. And later in this video, I'm going to explain one surprisingly common nighttime habit that quietly increases strain on the heart in many adults over 50. It's something millions of people consider harmless, yet cardiologists regularly warn patients about it after diagnosis. And I'll also explain why some people continue feeling exhausted even after treatment begins.